Hello, and I want to welcome you to 2022. I'm Dr. Krotz, and I'm coming to you from Inovi Fertility and Genetics Institute in the center of Houston. And today we are going to talk about egg freezing. And basically, egg freezing is a good topic because egg freezing is about planning for the future. And as it goes in the beginning of a new year, we're always thinking, or a lot of us are thinking about what are we going to do this year and what are we going to do differently and how are we going to make things better for 2022 and beyond. So egg freezing is something that's becoming more and more common throughout the world. And basically, egg freezing is a process that is very similar to in vitro fertilization, except instead of fertilizing the eggs are stored for a later time and a later purpose. So some of you may be wondering, is egg freezing right for me? And what should I do in order to prepare for egg freezing? So, what are some of the most common reasons for egg freezing? Well, a lot of it has to do with the way modern life is structured nowadays. And a lot of us are putting off starting families or doing other things because, we want to go to school, we want to finish our degree, or we want to go to graduate school, or we want to get the extra training, or we're focused on our job and we need better mobility. So, life has changed a lot even in the past 20 years, but some of the basics of biology and especially egg biology have not changed for thousands of years or more. And so egg freezing has become more and more popular because as we get, or as further along in life, our fertility tends to decline. Now, the thought is that fertility just declines for women, but it also does decline for men. It's just at a much more slow rate than it is for women. For women, women are born with a set number of eggs. They're born with 1 to 2 million eggs. And then by the time they're 14, they have around 400,000 eggs. And each month, 1 egg is released and 1,000 eggs are absorbed and they just go away. So, at the end of 400 cycles on average, you'll be around age 51. And once you have less than 1,000 eggs, that's the age of menopause. So now that we've set up some basic expectation about menopause and the timeline, the other important thing to remember is that egg quality does change over the course of your life. And by the time that you're in your mid-30s, you only have about 6 to 8% of your eggs left. It's also at that time where the percentage of eggs that are abnormal starts to increase. So when you're 25, about 25% of your eggs are abnormal, and that means 75% are normal or good. Then when you get closer to 35, the percentage of abnormal eggs starts to increase, so that by the time you're 38, about half the eggs are abnormal, and then once you're 42, 3/4 of the eggs are abnormal. And this is the process or cause that I should say of infertility increasing after the age of 35, and is also the reason that there's an increased risk for miscarriage and Down syndrome after the age of 35. And the reason for this is that as the eggs are developing and they are separating, or the chromosomes are separating off the egg and the smaller cell next to it called the polar body, there are more and more mistakes made as you get older. There really isn't anything that you can do to reverse these mistakes from happening, no matter what you're doing in terms of health or fitness. Some things that you can take, for example, are things like CoQ10, and that is thought to help with the mitochondria, the little energy factories in the egg, and they can help reduce some of those risks for abnormal chromosome counts in the eggs, but it cannot completely reverse it or stop it from going on. So, as we talked about, why would anyone want to freeze their eggs? Well, because they want to delay childbearing for one of several reasons. The first one could be their career. They're very focused on their career. The next one, for example, could be education, that they want to finish a degree or complete some sort of training. And that's pretty common with people that go to graduate school or medical school or do some sort of residency training. The third most common reason is for people that have been recently diagnosed with cancer or some other medical condition where they have to take either medication or receive radiation therapy that can damage the ovaries, or they may need some surgery where the ovaries need to be removed. Fertility preservation or egg freezing can also be used for women that have a hysterectomy and don't intend to conceive anytime soon, and the eggs can then later on be used with a surrogate. And then finally, the other category where egg freezing is appropriate is for women that are at risk for early menopause. So that means they either have a family history of somebody undergoing menopause before the age of 40, or they have a condition like endometriosis in which the lining of the uterus spills out of the tubes and then attaches to the ovary and starts to grow and damage the egg count. And endometriosis damages the egg count by growing on the surface of the ovary and then damaging the eggs that are on the surface of the ovary. And the surface of the ovary is actually where the main supply of eggs is located. And as they develop, they continue to develop on the surface and then go a little bit below the surface before being released and going into the fallopian tube. So, another question too that we often get is, so when should you realistically think about egg freezing? Well, the average age for egg freezing in the United States is age 37. And I would tell you, though, that the ideal age to think about egg freezing is really under the age of 30. Although for a lot of people under the age of 30, they're focused on other things like their career and education and may not really be thinking about starting a family yet, or may not even be married, or that's really not on their radar. Then a lot of women around the age of 30 to 35 can start thinking about it more seriously. And I would really advise you, if you're thinking of freezing your eggs at that time point, really that is the ideal time to go ahead and freeze your eggs. Now, egg freezing before was considered experimental until 2012, when the American Society of Reproductive Medicine said that egg freezing is no longer experimental. And since 2013, a process called vitrification has gotten to be much more widely used. And what does vitrification mean? It means that the eggs are frozen more rapidly, and therefore when they're frozen and then later on when they're thawed for use, they have a much higher likelihood of succeeding and turning into a baby because they were not damaged from the freezing or thawing process. And the main way that freezing damages the eggs is by allowing ice crystals to form inside the eggs. So vitrification has really revolutionized the way that egg freezing is done. And also, since that time, egg freezing has gone up 200 to 300% internationally. Now, some other people may be wondering, well, is egg freezing safe? And the short answer of it is yes. There really is no increased risk for birth defects from the process of egg freezing in and of itself. And the procedure that's used to do egg freezing or to retrieve the eggs is basically the same as IVF, and the risk for problems with IVF during the egg retrieval is around 0.3%. And that's much better than what is typical for surgery, which is around 5%. So it's a very safe procedure with only a fraction of 1% risk of having problems during the egg retrieval. Now that you've been thinking about it or heard about egg freezing, what are some of the steps that you may need to take actually to prepare for egg freezing? Well, the first thing that you should do, of course, is make an appointment with a reproductive endocrinologist. Now, the good thing about egg freezing or IVF is usually that you have to go to a fertility specialist to have this done. For inseminations, there can be other types of physicians that perform it, such as an OBGYN or sometimes even family medicine doctors. But for egg freezing, the fertility specialist is really the only person that is trained to do it. And the fertility specialist can sit down and basically guide you and let you know what the expectations are and answer your questions, and then also tailor a program that is specific to your specific situation. So after the initial consult, when the physician talks to you for 20 to 30 minutes, typically they'll recommend several types of evaluations to be performed. Now the first one will be blood test. So they will go ahead and check your AMH, which is the anti-Müllerian hormone level, and that's basically an indirect measure of your egg count, and that can tell them basically what kind of medications to prescribe you for your egg freezing procedure. Now the AMH stands for anti-Müllerian hormone, and that's a hormone that's released by the little cells that surround the egg called the cumulative cells. The more eggs you have, the higher that value is, and the less eggs you have, the lower that value is. The thyroid hormone is also something that is usually checked, because if your thyroid hormone is low or high, that can also interfere with the stimulation process. The second most common test is a pelvic ultrasound, and the pelvic ultrasound will allow the doctor to see if there are any problems with your ovaries, if there are any cysts, and also allow them to perform an antral follicle count. The antral follicle count is basically a measurement of the follicles or which are on the surface of the ovary, and they also represent roughly the number of eggs that are available to respond to the medication that would be given during that cycle. So the antral follicle count is also a very useful tool in combination with the AMH to determine what kind of medications can be taken. Now, I have an interesting question here that I'll address, and that we'll get to also later on in the talk about how many eggs are frozen per cycle. Well, realistically, the goal of the egg freezing procedure is to freeze as many eggs as you can per cycle. And when you go ahead and retrieve the eggs are a combination usually of immature eggs and mature eggs. So only the mature eggs are the ones that we keep, and those are the only ones that can be fertilized. And an ideal number of eggs to freeze in total is around 25 eggs. And typically, with somebody that has good ovarian reserve, you can freeze about 10 to 15 per cycle. So, the AMH, for example, some of the research that I did on Brown will give you an idea of that even before we start the egg freezing process. So an AMH level of less than 1 will on average give you 6 eggs. An AMH level of 1 to 3 will result in an average of 13 eggs withdrawn. And then anything higher than 3, which is very common in polycystic ovarian syndrome, usually will give you about 19 eggs in total. Now, sometimes some women ask, well, if I have irregular cycles, will I be able to participate in egg freezing as well? And the answer is yes. Part of your evaluation will also be to figure out why you have irregular cycles. Now, a lot of times women are worried because they have polycystic ovarian syndrome, and while that may be an issue for you to get pregnant on your own, it's actually one of the easiest things to address for fertility patients. And then even in egg freezing cycles, patients with polycystic ovarian syndrome tend to get high numbers of eggs and often get 15 eggs or more. So, what should you do in the meanwhile while you prepare for your egg freezing cycle? Well, we recommend healthy eating and exercising 4 to 5 times a week, and that can include even walking for 20 to 25 minutes a day. We recommend taking CoQ10, 600 milligrams once a day for women that are over the age of 35, taking vitamin D on a regular basis, and also a multivitamin is helpful. So once you've decided that egg freezing is for you, then the process can begin. And typically the way the process begins is that you take birth control pills for 2 weeks, and then your menstrual cycle starts, and then you start to receive injectable medications. Now, a lot of people worry about injectable medications and big needles, but here in the office, we show people how to use the injectable medicines, and they're usually small needles that are placed in the abdomen. So this process of taking injectable medicines goes on for about 8 to 12 days. And during that time, you'll get blood work done to see how you're responding. And also, we'll check the development of the follicles with the ultrasound. Now remember, I told you that the follicles are the little fluid-filled cysts in the ovary, and not every follicle has an egg, but typically about 80% of follicles have an egg. So for example, if we have 10 mature follicles, then we expect to get about 8 eggs. Now this is a common thing that I see discussed among patients, especially those coming from other fertility centers, that they correspond that the total number of follicles that they have should equal the number of eggs that they get on retrieval. But typically, the follicles that will give us a mature egg are those that are 14 millimeters or bigger. So when we do the stimulation, our goal is typically to get at least 2 follicles that are 18 millimeters in size, and then the majority of them measuring more than 14 millimeters. And this is the way that we can determine when it is a good idea to perform your retrieval. Whenever we see those findings on the ultrasound after 8 to 12 days of stimulation, then we know it's time to give you the HCG, which is the medication that prepares you for the egg retrieval. So the HCG allows the egg to come off the wall of the follicle in the ovary, and then we set you up for a time to come and have the egg retrieval done. So 35 hours after you get the HCG injection, you'll come to the office and you'll receive IV anesthesia after meeting our wonderful staff, and then the egg retrieval will be performed. The egg retrieval in and of itself only takes about 10 or 15 minutes and is a very quick procedure, and you're able to go home typically 1 hour after the procedure, and then you only take or need to take about 1 day off from work. The recovery is pretty quick. Then afterwards, recommended that you don't do any sort of running for another week or 2 weeks, because you may feel uncomfortable just because your ovaries are enlarged after the procedure. So after those eggs are removed from the body, the embryologist looks at all the eggs and then takes the cumulus cells, the little cells off surrounding the eggs, and then determines which ones are mature. And those mature eggs are the ones that are then frozen with the process of vitrification. And vitrification takes the eggs down to minus 70 or minus 80 Celsius, and then allows them to be stored for long periods. Now, contrary to what people think, it's not the amount of time that you store the eggs that determines whether or not they'll be good later on. It's the age which you are at when they are frozen. Now, some eggs can be lost with the freezing and thawing process, but this is typically pretty low and in between 1 to 5%. The biggest thing, like I said, in terms of determining whether the egg freezing will be a success is determining, or I should say, is the age at which you decide to undergo the procedure. So women that are between the ages of 30 and 34, typically each egg has about an 8% chance of returning into a baby. Women that are between the ages of 35 to 37, it's about 7%. 38 to 40, it's around 4%, and then 41 to 42, it's about 2%. So really, once you're getting close to 35, the sooner that you decide to do the procedure, the better it is for your long-term success. Also, we talked about the number of times that you should do the egg freezing, and as I mentioned, typically we recommend doing the egg freezing twice so that you can get close to 20 to 25 eggs. That is what is going to give you the best chance of succeeding later on with having a baby after egg freezing. So when you are, around the ages of 30 to 34, if you freeze 25 eggs, that can give you up to a 90% chance of having a baby in the future. Whereas once you get to 40 or 41, then that same 20 to 25 eggs may only give you a 50% chance of having a baby in the future. So the age at which you freeze your eggs is critical. Now, when you freeze your eggs, I would not call it an insurance policy. It's more like a reassurance policy, as I like to say. And that is because later on, as time passes, you know that you will have those eggs to use no matter what situation that you are in. So for example, let's say that you freeze your eggs because you do not have a long-term partner and are not sure when you may have a long-term partner or get married. So for example, if you're 34 and you freeze your eggs, and you don't know if you're going to be in a long-term relationship, but then you end up getting married at age 37, you can use your eggs at that point, but even better, you could conceive on your own at that point. And the best thing about this is, it doesn't mean that you have to use your eggs, but you know in case you need to use your eggs, they will always be there for you to use. So a lot of times patients may freeze their eggs and then they're able to get pregnant on their own and they don't need to use a frozen eggs. Or maybe they get pregnant on their own for the first time or the second time, but then by the time they're ready to have the third child, they're over the age of 40 and they're starting to run into difficulty. That's also a time when you can decide to use your frozen eggs as well. So the opportunities and the combinations of things that you can do and the flexibility that freezing your eggs allows you is great. And this is so much better than before, where 10 years ago, when egg freezing was not very good or very successful, that to freeze or to preserve your fertility, a lot of times you would have to freeze embryos, which means that you are committing to a sperm donor or to using a partner that you didn't necessarily see as a long-term partner. Now with egg freezing, you have complete autonomy over what you want to do with your eggs, and then also later on it makes the question of disposition, in other words, what to do with the eggs if you don't want to use them, a little bit easier to decide than what you would do if you were to have embryos frozen. So finally, when you decide to use your eggs, what does the process look like? What happens? So you will contact your clinic and you will go back to the clinic and say, hey, I'm ready to conceive. How can I use my eggs that I stored several years past? And so basically, you would go to the clinic and the eggs would be unfrozen, and then the eggs would be injected with a sperm in a process called ICSI. Now, for every 10 eggs that are injected to create embryos, you'll end up with around 3 to 4 embryos at the end of 5 or 6 days of embryo development. So not every egg will then turn into an embryo that can be returned to the uterus. So once that egg has been fertilized and it turns into an embryo on day 5 or 6 called a blastocyst, the blastocyst can then be checked to see if the chromosome count is normal, and then those embryos that have a normal chromosome count can be transferred in the embryo transfer procedure. Now, and that's part of the reason why we recommend freezing 20 to 25 eggs. In some cases, you may have 10 eggs and only end up with 1 embryo. And if the embryo, for some reason, is abnormal, then you would have frozen your eggs without being able to conceive. But once you freeze 20 to 25 eggs, you're giving yourself a much better chance of guaranteeing that you have at least 1 or 2 embryos to transfer, and then being able to conceive and have a child as a result of the egg freezing process. So other questions that we hear sometimes is, what kind of medications do I have to take? Well, there are 2 common medications that are used in almost all IVF cycles, and those medications are Gonal F, which is FSH only, and FSH stimulates the development of the follicle in the eggs, and Menopur. And Menopur has both FSH and LH, and the LH allows the follicles to develop by allowing the follicle to make hormones so that it can expand. The other choice that the physician will then have to use is which medicine to prevent you from ovulating. One is called ganirelix, and that's usually started after 4 or 5 days of stimulation, and the other one is called Lupron, and microdose Lupron can actually help with the stimulation in the early stages. Now, I got another interesting question that says, at what stage does the embryo split? And usually the embryo splits after day 6 or day 7. So usually the embryo does not split when it's in the lab. It splits after it is transferred to the uterus. And if the embryo splits, then the type of twinning that you have is something called a monozygotic twin or an identical twin. And identical twins, of course, are extremely cute, and everybody loves identical twins. But in terms of pregnancy, there are higher risks for identical twins, and sometimes the identical twins have to be delivered early to prevent any problems from occurring during the pregnancy. So embryo splitting is not extremely common, but every once in a while we do see this happen in the IVF center. Another interesting question too that goes along with that is, how many embryos are typically transferred? So nowadays we typically recommend the transfer of one embryo, because if we transfer two embryos and a pregnancy occurs, up to 40% of the time it can be a twin pregnancy. And in that case, those twins are typically not identical twins. And also, there can be an increased risk of problems with a twin pregnancy, such as early delivery or high blood pressure or high sugar for the mother. So nowadays, as I said, the American Society for Reproductive Medicine recommends transferring one embryo at a time, because that is the safest for the mother and that is the safest for the baby. So if you are at all thinking about egg freezing, I recommend that you reach out to your fertility physician, or at least go onto their website and look more into it. It is becoming something that is more and more common. It allows you a lot of flexibility in deciding when you want to start your family and what you want to do or focus on at that time in your life when you're making that decision. And 2022 is the year to think about the future and to move forward from everything that we've been experiencing the past 2 years. And I want to thank all of you for joining me on this live. And if you have any further questions, you can reach out to us or check us out online at inovifertility.com. And I wish you all the best this year. Thank you.